Hi, my name is Dr. Miriam Lusberg, and I'm a medical oncologist at the Ohio State University Comprehensive Cancer Center. I want to thank you for participating in our study and say that we appreciate you taking the time today to watch this video. In the video, we will talk with you about the importance of taking your medication as prescribed by your doctor, and we'll describe strategies that can help you take this medication every day. In the video, you'll hear from two physicians, Dr. Ramaswamy and myself. We work with and help patients like you. You will also hear from some real patients who at the time we created this video were taking the medication that you soon will be taking. All of us wish you the very best during this important phase of your treatment.
So at the time that the patients are going to initiate their anti-hormonal therapy, so that visit is the visit that we expand a lot about this therapy. So the first thing that I do is explain to them why they're taking this medicine. Okay, I explain the mechanism of action, how it works and reduces the estrogen levels in their body, and this estrogen is what feeds their cancer. And so now we're cutting the food line to the cancer cells. So if there are any cancer cells that have survived the previous therapies, the surgery, radiation, plus or minus chemotherapy, this therapy would take care of it.
I'm very excited to share with you all that we know about this class of drugs called endocrine therapy agents. The oldest drug is tamoxifen, and we also have newer drugs called aromatase inhibitors, and they have revolutionized how we treat breast cancers. They're one of our most effective agents. They reduce the chance of breast cancer recurrences by close to 50%. So they're wonderful drugs, and overall they're very well tolerated by many women. Millions of women are currently taking these drugs. They're once-a-day pills. There are some side effects that I also would like you to know about. They include hot flashes for some women, some joint symptoms, some changes in libido for some women. But overall, they're extremely well tolerated, and many women are able to take them without any actual side effects.
I think we should all be very honest with our doctor in how we feel. And what we're going to do. A lot of times we tell the doctor we're going to do something, we don't do it. And he doesn't understand that you're not doing it, so he can't help you.
It's extremely important to be open and communicating with your doctor at all times, because they have the answers that you sometimes don't think. You think you're the only person going through it. And you think, well, no, they'll think I'm dumb. But you really need to talk to the doctor about everything.
Well, it's really important to be open and honest with your doctor and let them know. A lot of times women will try to hide the fact that they're having symptoms that they are, and just let them know exactly what's going on with you.
If you don't tell them exactly what your symptoms are from the medication, how you're feeling, then they have no idea. And the best thing is to make a list of all the things you want to talk to them about and explain to them that, this is causing this or this is causing this, and what can we do to change it.
Open communication is critically important. A lot of times patients are afraid to voice their concerns and symptoms because sometimes they don't want to bother us. I've heard many times that they say, well, I know you have so many sicker patients and I didn't want to be a bother. So in talking to them, I just want to reemphasize that every patient is an individual and we want to hear from each of them. So if they're having problems, it's really important for us to know. And for them to not be afraid to tell us if something is not working for them, rather than taking things into their own hands, either not taking the pill or avoiding visits because they don't want to disappoint us for not taking their pills. We just want to hear what's going on. And if we know about it, there are so many things we can do to help those symptoms and make it easier for them.
And also not giving up. Say the first 6 months it's been really, really hard with the hot flashes and the aches and pains. Okay, I've got to live like this for 5 years. This is just never going to change. I would say don't lose hope that way. Many of these symptoms do get better. And we don't have only plan A to help you. We have plan A, plan B, plan C, sometimes even further than that.
It's really important
if you have any problems, to call about them, but not to stop it, but to keep on with it. There are alternatives available, other medications that do the same thing. And sometimes it's a matter of just finding what fits.
If you find something that's not working, communicate directly with your physicians. They will find something else that works for you.
So I think with many pills, as with these, it's helpful to take the pill at the same time in a day because you're less likely to forget them. So I have patients sometimes putting the pill bottles right at their nightstand so they know to take it when they go to bed, or some patients take it with all their morning medications. So just taking medications at the same time each day has been helpful for a lot of patients. Other strategies, maybe telling your family members that you're on this medication, and so sometimes they can give you friendly reminders.
Compliance is a problem sometimes because you forget to take the medicine. When we were in our forum group, one of the ladies said she finally bought a pill box, which she thought was just for her mother-in-law, but her 80-year-old mother-in-law, but she said that helped her compliance. So I think that anything you can do to keep yourself in compliance with the medications can only be a positive.
So having something to remind me to take the medication is good. And it's my habit to get up and take it first thing. So I think it's important also for any medication to have a habit of when you take it.
I don't remember if I took my morning medicine. You look at your pill box, and if the morning thing is empty, you took it.
The providers want the same thing as you do. They want you to live as long as possible cancer-free. And they're doing all this for that, and you want to do the same thing. So communication, calling, and be forthright with your questions, whatever that is very, very critical. The ways I would think is, first of all, whenever you have problems and questions, write it down somewhere. Have a book or someplace, an iPad, whatever works. Write it down, your questions, because sometimes you may not remember that in that moment within that room of the 20 minutes. I think whatever ways you can to efficiently get all your questions answered, make sure you have your questions. And also, it's okay to say, I didn't understand that. Can you say that one more time?
Questions actually help you to heal because you don't sit around and worry about something. It's out there in the open, and you get your answer, and then you can move on.
It is important to talk about the concerns you have. The doctors aren't mind readers, and I think people think that because their blood pressure's taken and their temperature's taken, why, that's all the doctor needs to know, and they'll figure it out by themselves. Well, like I said, they're not mind readers. They need to hear your concerns. They need you to talk to them.
You have to be your own person who takes care of you because nobody else is going to know what's inside of you.
So after you listen to this video and understand why you're doing anti-hormonal therapy and the side effects and how you kind of communicate better and deal with it, as part of this program, you're also going to receive regular text messages and other interactive measures where you can communicate your symptoms as well as have tools that will be communicated back to you right away to help you with those symptoms, and some reminders that I think can help you again, both with being compliant as well as with communication. So I can tell you that would be a wonderful, wonderful tool to have.
We appreciate you taking the time to watch this video and hope this information was useful. You will soon start receiving text messages from us on your phone, and thank you in advance for reading these messages. Like the video, they're meant to help you. Thanks so much for taking part in this study.